Good day, this is the Professopher, CBMD PhD, and today is Monday, January 30th, 2023. It is 5:43 and 37 seconds, a.m. Eastern Standard Time, and today's research, heart conditions. So let's hop to it here, as we are predicting two common heart conditions, date January 26, 2023, source, Cedars-Sinai Medical Center. The two novel research studies move the needle on predicting two important heart conditions, sudden cardiac arrest, which is often fatal, and increased coronary artery calcium, a marker of coronary artery disease that can lead to heart attack. Researchers identified a panel of novel blood biomarkers specifically associated with sudden cardiac arrest. These biomarkers have the potential to enhance the clinical prediction of sudden cardiac arrest. As sudden cardiac arrest is a sudden loss of heartbeat that affects more than 350,000 in the United States annually. Despite an organized emergency medical response system, fewer than 10% of individuals who have cardiac arrest will survive. The dismal survival rates for sudden cardiac arrest exemplify the need for risk determination, early prediction, and improved primary prevention. The research has led to novel methods of predicting sudden cardiac arrest that are currently being evaluated with the goal of deploying these in clinical care. The researchers analyzed a large number of blood biomarkers obtained from survivors of sudden cardiac arrest, comparing results from one cohort of people without coronary artery disease and one cohort with the disease. The researchers identified a total of 26 protein biomarkers associated with sudden cardiac arrest. 1 cases were compared to controls, of which 20 differentiated sudden cardiac arrest from coronary artery disease. While these biomarkers have the potential to enhance prediction of sudden cardiac arrest, future studies are needed to replicate these findings in a larger group of patients. The researchers show for the first time that an ultrasound image of the heart can be read by an artificial intelligence algorithm to accurately identify whether a patient has a large amount of buildup in their coronary arteries. As traditionally, coronary artery calcium buildup is diagnosed using CAT scans, which are not available at every center, expose patients to radiation, and are costly. On the other hand, heart ultrasounds, also called echocardiograms, can be done in a clinic or doctor's office, do not produce radiation, and tend to be much less expensive. Researchers show that echocardiograms, when interpreted with artificial intelligence software, can predict coronary artery calcium and predict heart attack risk nearly as well as CAT scans. Using a dataset of 2,881 echocardiogram images, investigators trained a video-based artificial intelligence tool to predict coronary artery calcium scores. The scores range from 0, representing a perfect score, with no indication of coronary artery calcium buildup, to more than 2,000, a poor prognosis for individuals, representing high risk of heart attack and coronary artery disease. The video-based deep learning model successfully predicted scores of 0 in patients with good health, as well as high coronary calcium scores, likely foreshadowing a worse future prognosis. The research team hopes the sufficient technology, inclusive of a coronary artery calcium score for each patient, may be used in all echocardiogram laboratories. And this type of resource will allow for faster, potentially more frequent, and generally more cost-effective imaging that provides clinically valuable predictive information. And this is the Professor of Microbiology, Bioinformatics, and Pathophysiology. This video was created for educational purposes only. Hope you enjoyed listening. Until next time, have a great day.